So we're going to be talking about the perineal massage and stretching for birth prep. So this is your pelvis. Everything in red on this model is a muscle. So your vulva is all muscle. Your perineum is the space between the bottom of your vagina, which is here, in your anus, which is here. So this is your perineum, and you have a lot of muscles that attach to that perineum. This is where we want to be doing a lot of the stretching. So this is where most of the tears that occur during labor are going to occur. So we want this area to be as elastic as possible. So if you look on the inside, there's a lot of muscles that create that on the inside as well. So I have another visual here to just help see that a little bit better. So this is, the white is your bony pelvis, and it's flat, but obviously your pelvis is not flat. It would be bent up like this, and these are all the muscles that attach inside your pelvis, just color coded. So what we're really trying to work on, so for orientation, that's your tailbone. This is your urethra or your pubic bone here. So what we're really trying to work on are these muscles that create the opening. You can see, so this is your vagina. So you can see there's three muscles that go around the vagina, some around the anus, that create like a ring, and your perineum is in here. So if I flip this to the outside, so this would be like an outside perspective looking in. So that would be what we're trying to stretch, and that's the muscle that attaches to that perineum. So there's a few ways that you can do this. Obviously this is going to be backwards for demonstration purposes, but on yourself, you would use your thumb. You're not going very deep, like the first knuckle is as deep as you really need to get. If you're doing it on yourself, it's easiest with your thumb. If a partner is doing it for you, they can do it with fingers. It doesn't really matter. Just for your wrist purposes, thumb is easier on yourself. So you would go into the knuckle depth, into the vaginal canal, and you could use a U-shaped massage. Just for sake of the video, I'm using my finger because I can't show you with my thumb as easily, but you're pulling kind of from, if you think about this opening, the vaginal opening is a clock. So 12 o'clock is up towards the pubic bone, 6 o'clock is down towards the anus. You're kind of swooping and pulling, if this was stretchy tissue, which it is, from like 3 to 9. So like a U formation, and you are kind of pulling into the tissue to a point where you feel stretched, but it's not extremely painful. So that would be some perineal massage you could start with. That's pretty gentle. You can also do what I call like the perineal sandwich, where you're basically going to use two fingers, and you're going to be, one's inside, one's outside, and you're going to be like on the muscles and kind of rubbing them together. So like you're doing a massage that way. You can see there's a muscle that runs from your sit bone to your perineum, and then on the other side from your perineum to your sit bone. We want to massage all of that. So I'll show you from my finger in and out, but again, you would use one finger on the inside. So for you, probably easiest with your thumb going into the base of the vagina, finger on the outside, and then you would be doing this. I'm going to be showing you in a variety of ways, but I'm going to come from the opposite side just so you can see for the video. I would have one finger on the outside, just right at that perineum. So again, we're going to about that first knuckle of depth, and then one finger on the outside, and then I would just be on either side of the perineum. So 6 o'clock, and like as far as I can naturally reach out, and I'm literally just wiggling and rubbling and like pinching that muscle right on that perineum, right at 6 o'clock, and then as far as I can go naturally to the other side. So just kind of rubbing and massaging from there to there, okay? So if you could spend like a warm-up time of about maybe 5 minutes doing that U massage and kind of stretching and massaging into it, and then the perineal sandwich massage where you're kind of pinching and rubbing to loosen up that muscle and soften it, that would be good. And then getting into the full stretch, if you have a partner, it's going to be easiest to do with a partner. And this is something we'll review in person and do in person, and I encourage you to bring your partners for this. To stretch this area, we're thinking about that clock again. So if we think about the base being 6 o'clock, we're going to be angling at 5 and 7 o'clock. So not right straight down, but kind of a little bit to the side. So if you think about these sit bones, if I was to orient the pelvis the right way, these are your sit bones, like those pokey parts on your bum that you can kind of feel. that's kind of where you're gonna angle. So you would put, again, your thumb to about, or if a partner's doing it, fingers to about that first knuckle depth in, and then you're pulling to 5 o'clock and 7 o'clock. And so you would be doing this. So if it's a partner doing it, what I would advise is having the pregnant partner's bum right at the edge of the bed, and the other partner can come sitting, and they'll go with paired thumbs or paired fingers, and they're going to go in to the vaginal canal, just to that first knuckle, and then they would be pulling those muscles, stretching slowly down and out. So you're pulling towards that sit bone, so you're gonna get kind of that U-shaped stretch, and you just go to, there's a comfortable stretch, and then the pregnant partner is going to be breathing in and trying to relax into that little bit of discomfort. And then as that discomfort settles, then you can stretch a little bit more, and you would work on this for about 5 minutes after you've done the perineal stretch or the U stretch or massage.